Well, once again, we've entered into the second day of December 2017. Of course, we're winding up there quite very fast. And yesterday, we all commemorated and celebrated the HIV and AIDS Day. We attended a couple of functions. But today, in time, we are here on UBC to talk about water and sanitation. As you all know, you can't mention the word sanitation and then leave out the word water. They are both components that accompany each other. My name is Patricia Lokoma, and I'll be joined on set by three gentlemen from the Ministry of Water and Environment. And of course, we will be exhausting the whole issue of water and sanitation, the drive that has toured all over the country. And these gentlemen here are here to update us on what's happening there. On site, first, I'm having the principal PRO of Ministry of Water and Environment, none other than Mwonge Charles. Thank you so much for joining us.
Okay, thank you.
Give me a handshake.
Thank you very much for hosting us.
You're a warm gentleman. That's amazing. Okay, so just delving straight into it, because we just have about 45 minutes for this show. Like I mentioned, as I just began, water and sanitation are both components that accompany each other. And I know that the Ministry of Water and Environment have really pursued the drive of sanitation development within the country for quite a long time. So you give us the overview of this project.
Basically, the government of Uganda, through the Ministry of Water and Environment, is responsible for the provision of water and the sanitation services. And actually, water services, it is a constitutional right to the people of Uganda. Everybody is supposed to get water services. That one, there's no doubt about it. Now, when you come to the mandate and what the ministry does, that the ministry is responsible for the management of water and the environmental resources sustainably. And you know, the way to fulfill that mandate, it has segmented its activities in a number of directorates. For instance, it has 3 directorates. The Directorate of Water Resource Management, that one is basically responsible for the quality and the quantity of water. So the Ugandans are supposed to get enough water, and it must be of good quality. So there is that directorate which is responsible for that one. Also, there is another directorate of environmental affairs, which has to do with the wetlands, the forestry, and the management of the climate change. And of course, the issues of the water forecast. So the ministry also is responsible for in that area to make sure that Ugandans are well served. Also now the ministry had another directorate, that's the Directorate of Water Development. That one mainly to responsible for the development of piped water supply system. It is responsible for development of dams where they provide the water for animal and for irrigation. And also the ministry, under that directorate, there is what we call the rural water supply, where we have the boreholes, the shallow wells, to make sure that people enjoy clean and safe water. Yeah, basically that is the summary. But now what the ministry has done is to decentralize its activities in regions to make sure that services are closer to the people, and also that one helps appropriate allocation of resources and the proper accountability. That's why you see now we have the development facility, Northern Uganda. That one is responsible for the development of piped water supply system. And the headquarters are in Irira. So Northern Uganda also, that one takes the Western Nile, Lango region and Achol region. So people, if they want piped water, they don't need to come to Kampala. Then also when you come to the central region, we have the development facility, Central. That one will cover the greater Masaka and the part of Mubende. And that one also is responsible for the provision of a piped water supply system in that region. Then also when you go to Western Uganda, also we have sub-headquarters there. And the headquarters are in Imbalala.
Okay. Now, Charles, you've mentioned about, you know, the drive, the water and sanitation drive, but the way you're mentioning it's as if only the Ministry of Water and Environment is the only key player in this game. I'm pretty much sure that there are different stakeholders that come up and help the government as well to be able to source, specific locations, the mapping, all these other, activities that are engaged within the sanitation drive. So, is it just the government, the Ministry of Water and Environment, that is working on these projects, or we are having some other stakeholders that are playing part?
Definitely, the ministry does not work in isolation. For instance, we have the local government, we have the non-government organizations, we have the development partners who will pass with the funding, as my colleague will discuss in details. And also you find out that we also have even some agencies and parastatals. For instance, we have National Water, like and the Soldier Corporation, like when the ministry and the urban department construct water supply system in the bigger towns, it hands over to National Water for proper operation and maintenance. And also we have NEMA, we have Forestry and the Meteorological Authority. So there are so many key players, as my brothers are going to discuss in details. Okay,
so if I wanted to ask a question about the National Sewerage Corporation, would you answer some of those questions as the PRO?
No problem.
Okay, so there are certain areas in the urban center that really have a scarcity of water supply, I would say. And yet we are here, pushing on into the rural areas, helping out there, building the wells. And have we really well established ourselves within the central? Are we really having proper and adequate water supply within the central?
Yeah, partly we have.
And are the tariffs favorable?
It is relative. You might ask yourself, what is the basis of setting the tariff?
Okay.
Because you have to look at the operational costs. Operational costs are very important because National Water pays for power, it replaces the pipes, it pays for its workers. So usually that is the basis of setting the tariffs.
The tariffs.
But also now there is a policy which is going to segment the rural poor and the urban rich. The policy in place.
Okay.
Anytime there are going to be that differentiation of the tariff.
Okay, so we should expect a bit of harmonization when it comes to the rural poor. And then it's definitely, the tariffs won't definitely be the same.
It will not be the same in the future. And also the other question which you say that whether the water is enough or not. Some areas may not have enough water, but National Water, to the best of my knowledge, is constructing Gaba 3. Okay. The moment it is ready, then all the people will be able to get water. But also I've mentioned the issues of the Development Facility Central. The ministry, through the Development Facility Central, is constructing a number of pipe water supply systems. And most of them, when they are ready, they will hand over to National Water to do what? To manage.
To manage the process.
But this question is like when you have a home, food may not be enough, but it can be adequate. So it is natural. Yeah.
Okay. Now, because most of the time, what we understand with the national water within our country, most of the time our issue is, do we really have safe water? Is our water safe?
Our water is very safe and clean because it is well treated.
I have an issue with the treatment. Sometimes I boil my water. You get to freeze it, and we kill a couple of minerals and molecules in there, because we usually want to have our water with minerals, our water with the natural filling in it. But then sometimes probably the chemicals affect the taste.
That smell, yeah? At times it is natural, because like when
you compare the well water and the piped water, there's quite a difference. So do you think the mechanism, the strategy?
One thing I have to assure you.
Purifying that water.
One thing I want to assure you. The chemicals they use, they are well good and well tested. Therefore, the water
and the quantity is just enough.
The water is safe. It's like you go to the hospital. They treat you, but you get that smell of the medicine. But that medicine cures you.
But not for a long time,
So
not for a lifetime. Sickness is just a period of time.
It is relative in the environment where you stay.
I cook with water, I wash with water, I drink water, I smell water.
What I'm saying, it depends on the environment where you stay, and also where you keep your water.
Okay.
You may find that some of the jerry cans are not well washed. So now you get it. So, but to the best of my knowledge, the water provided by the government through National Water is clean and safe.
Okay, now let's talk about empowerment. You're sensitizing different communities in the sanitation and water drive. So how far have you gone, and what specific activities are you putting in place?
In most cases, we have a policy. When we are to construct a water supply system, we engage the community.
That's good.
Right away from the project design. For instance, when you go in a small towns, there's what we call the steering committee, where we have the community, the local leadership, ministry, and at times the donors. So whatever which is being done is agreed upon. We move as a team.
You work together with the community leaders?
Work together. That's why you see in the provision of water supply system, we don't have major problems because people are well sensitized, and we have a group of sociologists who are specialized in sensitizing people, engaging community. So we work as a team. There is no way you can put a water supply system without involving the community. For instance, in most cases, the community gives out the land. Free of charge, yes, through the local government.
If I opened up a call-in session and I had people call in to ask a couple of questions about the safety of water, the sanitation drive, we will get a different answer out there. But anyways, thank you so much for joining us. We are having our next session with the rest of the two gentlemen, and that is Engineer Paul Kato, the manager for the Eastern facility, and as well we will be having Engineer James Seguia, of course, on set. We're coming up. Don't touch your dial. I need these names. Welcome back. Like I said in the beginning, that we will be having three gentlemen from the Ministry of Water and Environment, and of course we're done with the peer there. Right now I'm joined on set by Engineer Paul Kato. He is the manager for the Eastern facility, and at the same time I have Engineer James Seguia. He's also the manager, an engineer for the rural segment in the drive of water and sanitation development in the country. Well, as we left off there with Mwonge Charles, we want to kind of pick on from there. Now, you handle the provision in the urban center, so you can answer those questions, and then you answer the rural part of it. Now, I would want to understand how the ministry provides services. First, let's talk about the urban centers.
Thank you very much, moderator. The ministry provides services largely through piped water supply systems. Here we're talking about getting water from one point and pumping it into a tank and then distributing it through pipes and making sure that the water is very close to each and every individual household. That's the basic principle we're using. I know that also in the rural areas, for some of the rural areas where we have bigger populations, we actually use the same technology, as my colleague also mentioned.
So briefly, can you define the technology? Because having a drive like this going on for quite a long time, there has to be some strategies, some mechanisms that have been put in place. Give us a brief of that.
Yeah, the ministry has been developing these facilities for quite some years now. Thanks, there was an increased drive in the provision of safe water services right from the 1990s. And it's continuing. And as we realize that that is an ongoing activity. The population is growing, and so as the population grows, the demand for water also increases, and we are time and again continuously having to review even the existing water supply systems. Areas which are not served, we have to focus on them and provide them with the same services. Areas which are served and now the design, the infrastructure which is in place is inadequate, has to be improved so that it meets the demand. And I think that's the best strategy we are using, continuous improvement.
Okay, so for the rural, I can understand, because most of the time you find these areas really green and raw, and you really have to lay the groundwork and everything. But then for the urban, what are some of those challenges that you face?
Our biggest challenge right now is financing. Financing is quite limited, and so we cannot, we are not meeting the demands of the ever-growing population. If you realize that the coverage of urban water services for the last 3 years has had marginal improvement. It has been more static because the resources which we have can only meet can only maintain the coverage. Yet our target is to make sure that everybody gets service.
So are you really getting the full support that you need from the stakeholders, like from National Water and all these other stakeholders that play a role in the key to make sure that water and sanitation development is really getting on? Do you get full support? Do you get updates from the public where water is supplied, or you're just dealing with the stakeholders per se?
The support comes in because people need the water. So every time we go to a community which doesn't have a service or needs improvement, they really give full support. They actually contribute land in most cases, and we are able to do the work. They are really supportive, and within the means, in the current economic situation, certainly, I think government is also doing its best to make sure that we continuously fulfill our mandate.
I think we're the only ones crying for the current economic. You guys, you're big.
It is also beating the government.
So basically, give us the overview of the rural water provision in the rural area.
Thank you. Good afternoon, viewers. James Seguya is my name, Principal Engineer in the Ministry of Water and Environment. I work with the Rural Water Supply and Sanitation Department. When we talk about Rural Water Supply and Sanitation Department, basically we're looking at settlements in our rural areas that are like up to 1,500, those settlements in rural areas. But we don't leave it at that. We again also focus on concentrated settlements that fall between 1,500 and 5,000. So in rural areas, what we do at the moment, we have 2 delivery modes for rural water supply provision. The first one is through the District Water and Sanitation Conditional Grant. That's money government directly sends down to district local governments to implement water and sanitation activities. Then centrally, at the ministry, again, we have funding, but there we focus on bigger systems like large gravity flow schemes. We do now solar water pumping.
Wow.
And that's, yes, those activities we do, really we find they cross district boundaries. That's why we decide to manage them at the central level.
And decentralizing them, like he had said, like Charles said, makes services closer to the people.
Closer to the people. So in so doing, for the district water and sanitation grant, that's basically implemented by district local governments. That money goes down. So it's up to the district to plan, budget, and implement activities.
But at the same time, the ministry needs to monitor the implementation.
That's where I'm going. So what we do, we've established regional structures down there. So in the eastern region, we have what we call a technical support unit. One is technical support unit 4. That is focusing on districts in the Bugisu and Bukedi sub-regions. We have Technical Support Unit 3, focusing on the TESO sub-region, and also Technical Support Unit 9. That one is looking at districts in Karamoja. So basically, when we send money, the staff we have in these units will go down and monitor what districts are doing, and also support them to implement activities in that in water and sanitation programs.
Okay.
Yes.
So as we can all witness, the climate has been changing quite a number of times. For the past few years, we have seen climatic times change. Where we expect rain to come, it doesn't come, and then the sun is so high, and then farmers are really losing out. Have you come up with different schemes to help the rural farmer to be able to benefit from this, water development provisions?
Nice question. I've talked about solar water pumping, okay, in rural areas. Now,
But you can tell us whether that directly helps the farmers.
Yes, now, what it is now, because we've realized that our rural farmers can no longer entirely depend on rain-fed, okay, agriculture. That's no more a question. They can't do that. So now what we're doing, when we go deep in the villages, we develop these piped water supplies that are powered by solar energy. But the focus now is we shouldn't only supply domestic. It shouldn't only be for domestic consumption. So we've modified our interventions to make sure that micro irrigation, when we talk about like high value crops, we provide storage enough water which people can use to do micro irrigation. But we also have the other department, the water for production department in the ministry. That one develops bigger irrigation projects where when you get organized farmers, then you can make sure that you provide enough water for them to do irrigation. But even under the rural, it's now a focus that whatever we do, it's not only domestic consumption. Have additional water which people can use to improve their income.
True.
Yes.
So have you come up with specific trainings in order to reach out to these people? Because you said you have different officers in different centers to be able to reach out to the public, to the community.
Yes.
So do you engage them in tailor-made capacity building schemes?
Yeah, like our previous colleague mentioned, the issue of capacity building and training is really emphasized. You cannot provide the service and leave it there. For one of the things people have to appreciate is that government is targeting providing resources for the infrastructure development. Maintenance and sustainability of this infrastructure is the responsibility of the users. Without that training to the users, there is no way these facilities
Are you sure the ministry is really engaging the communities with training? That's why I'm emphasizing on that question.
Exactly. Otherwise, by now, if you look at the functionality now of all the water supply systems we have, water supply infrastructure we have in the country, at least we are 85 and above, and the people who have contributed to that are largely users. So we are. I think the message is in there, and people are really doing quite a good job. You can only improve and make sure that we reach that.
The way you're bringing it out is as if there are no challenges at all.
Challenges remain, and challenges.
We still have some areas in the urban that are really having issues. Can we talk about that?
That is fine. There are quite a number. For example, you mentioned the dry zones, at least that within the central region. Those ones largely because we have not yet reached each and every person, and this is work ongoing to make sure that each and every person gets
But in the areas that you're already there, is there enough sensitization? Is there enough awareness?
I would, in my view, my personal view, is that it's adequate sensitization. It's adequate. I will not say it's 100% because I have not done that study.
And that's not your area?
Not that was my area.
Oh, I wanted you to say that.
It's part of my responsibility.
Yes, I can add
Okay.
to what Paul has said. You know, our approach is quite amazing. It's a demand-driven approach.
So that means you get feedback.
We get
then
feedback.
You mold on what's not perfect yet, and then get back and get more feedback and more feedback.
Yeah. In other words, even before intervention, we let the beneficiary communities demand.
Okay.
That is the starting point.
And how do you do that? How does that work?
Well, there are structures. You know, it's right from, if I can talk about how they do it using the grant. You know, you have at the lowest level, you have the PDCs.
Okay.
Yeah, the parish development committees. They are really in touch with the communities. They know what communities want. They know the issues at that level. From there, you come to the sub-county level. Still, they are in touch with the communities. So the demands come from down there. The demands come from the locals. They end up with the district.
The biggest role for the ministry is to do the implementation
Yes.
of these development strategies.
Yes.
And then you let the local government, the local leaders handle. But we talked about monitoring the money, the
Yes,
funds
yes.
specifically, but also monitoring the services is key.
Yeah.
Are really these people receiving the sanitation ethics that we need, the sanitation activities? Are they really engaged? Are people washing their hands? When, like you may be saying that, yeah, we are over here and there and there, and then in a couple of months we hear there is cholera in a specific region. Who do you blame? Is it the local leaders if something like that happens? Or do we just leave it to nature?
I think when it comes to personal hygiene,
It starts with the individual.
It starts with the individual. The ministry has made an effort together with other partners, Ministry of Health and even Ministry of Education. We have made a lot of effort to try and keep the people sensitized. And as you know, sensitization is a continuous activity.
Yeah.
It never stops. Not to have put an infrastructure in place have gone away. It's something which has to be continuous. We have structures, for example, we have health inspectors at each and every local government. And this is
And
the
they
song,
visit seasonal.
and this is a song they are singing all the time. But you see, the problem is that they cannot necessarily force people to wash their
Impact
hands.
on an individual
But they
specifically.
try to sensitize, teach people. And I think it's high time we also encourage our schools to emphasize, at least when people are still in school, to make sure that people grow up knowing that it's important to wash. That personal hygiene is very important. Now I'll talk about the sanitation infrastructure. Right now, the ministry's core mandate in the sanitation infrastructure is largely in developing public sanitation facilities and also setting up fecal sludge management facilities. Increasingly, we've had a gap whereby our small towns are growing at a relatively slow pace. Where the government has encouraged various schools and people to build ecologically friendly toilets.
Okay.
And the impact of that is that when these ecologically friendly toilets get filled up, then we have a problem with empty. Now we are, as a ministry, we are trying to look at setting up fecal sludge management facilities, at least initially at the regional level, such that, and providing other incentives so that people can be facilitated to empty safely that waste. Right now, dumping is done in many areas. They are dumping in the open environment, which is not very friendly. But the drive
It's funny,
now,
sometimes
pressure
it's
is
even
on.
in the urban areas.
Yeah, but the biggest challenge I think has been lack of these facilities within reasonable distances. Can you imagine somebody from Kamuli, about 40 kilometers away from Jinja, has to hire a truck from Jinja, come empty their toilet and bring the waste back to Jinja? That's a huge cost. Now, if we put one in Kamuli, for example, at least that distance, be short, and we think that people will be encouraged to, one, build the appropriate toilets, and also have these services be closer, and they'll be able to empty them at a lower.
I should also supplement, and I think I want to focus so much on what happens in rural areas. I told you we do send money to district governments. They are in charge. We monitor. But what avenues or what measures are we doing to make sure that the component of sanitation and hygiene promotion is also done? First of all, when they are budgeting, we make sure that there is a certain percentage of the total grant. And that's, I think, at the moment, it's around 14%. We're saying around 14% of the budget should go for software. We call them software activities. Go software activities, where you have sanitation and hygiene improvement at that level. And we monitor to make sure that they do it for all activities. Then secondly, even our interventions here at the ministry directly, sanitation and hygiene promotion is an integral component. We do sanitation facilities.
Because with me, I'm always on TV, and especially our very own channel. If there's any sanitation drive that has to go on within Kampala, usually it's the Ministry of Health that does that. We do see the sensitization, the awareness, and you know, cholera is an outbreak right now. It's on the move, so people wash hands. So does this mean that also Ministry of Health also falls into play as one of the stakeholders?
Ministry of Health
in the drive of sanitation.
Ministry of Health is taking lead when it comes to sanitation. But you see, you cannot provide water and you fail to address the sanitation issue. That's how Ministry of Water and Environment comes in. Because we are putting water in the environment, and much of this water has to be safely disposed out of the environment. And therefore we have a big role when it comes to sanitation. Also, one of our objectives of providing safe water is to make sure that water-related diseases, waterborne diseases come down and eliminated from this community. So there is no way we can disassociate ourselves from that role of sensitizing and trying to teach people, educate people about the sanitation. I must point out that from our recent report, actually our sanitation coverage, but here I'll emphasize availability of toilets at least 80% and above within the country, which means that we have a 20 gap, at least when it comes to the toilet, but when it comes to hygiene, we have a very, very personal hygiene. All of us have a very big
part to play
and a very long way to go. You will notice the containers we used to fetch water from this. Water may be safe at the point of collection, but the cleanliness of the container you're using as well. That's an issue.
That's why I asked Mr. Mwangi Charles that what are these specific awareness activities that you're putting in place. And because we had to wind up, he didn't give me that specifically in a proper answer. But what I really want, because people are out there, not everyone is going to understand the technicalities of the words you're using, but they want to know, how does the Ministry of Water and Environment really reach out to me as an individual, as a citizen? How do I benefit from this particular ministry? So when we say we engage them in sanitation drives, in sanitation activities, can we a little bit be specific, one or two?
I think unfortunately, I think, unlike Ministry of Education, Ministry of Health, which is all the time doing this, for us we do it to specific communities.
Okay.
When we are developing a water supply system, we have to sensitize, because that's the opportunity we are in that town, and we continuously sensitize. Then we hope that those who take over after construction, actually, when you come to the development facilities, we are not supposed to allow water to flow unless each and every household within the supply area has a toilet facility.
Okay.
That one is a target, and we're trying to push for that, so that people.
And do they abide?
Yes.
Yeah.
Because we have a carrot. We have a carrot, and the stick is that we shall not open the water, and everybody wants the water, so they do abide to that. But now.
But then, if you put it that within the types of toilets, we'll just to meet the target so that they can get the water.
As I said,
I should also add. You see, what you should appreciate, the mandate for sanitation provision is like under 3 ministries.
Okay.
You have health, you have education and sports, water and environment.
Even local government.
And local government. Actually, that's the
Also,
4th.
the media has a part.
Oh, a big one. But now, what we realize when we decide to intervene piped water supply in a given area, our mandate will, allows us to keep within that area. Okay? As Paul has said, we do a lot. We do trainings, we do engagements with community, and we also have that requirement that if you are to give you a connection, then you should meet the following requirements. The conditions. Make sure that your sanitation around your place is 100%. You have a drying rack. There is a proper latrine. So you have those conditions you put, which people do. But you know, when you get out of this project area, there are people within that area which are maybe outside the project area, where you're not going to reach, because for you are limited. Given the mandate, you are limited to stay within where you're working. So I think there is an issue which has to be addressed to make sure that we can benefit from synergies from the different ministries that are playing a role in sanitation promotion. Health should commit money and also be able to make sure that activities are done. Education, at the same time, they should also commit money and make sure that these activities are done. But for us, we go in with a commitment, but we are limited. So there's a lot, and I think local government and also OPM is trying to help us to make sure that when we decide to go in for water supply, then all of these other ministries are in and they commit also money to make sure that you are 100%
I thought
done with sanitation.
You're receiving support from one of the providers, the European Union and all these other stakeholders. I thought that money now shouldn't be a problem. It's just the implementation that should be a problem.
Money.
The grants, the funds that you're receiving from all these other stakeholders.
Yeah, well, if you look at the proportion of the annual budget.
Or we can go with the phrase that money is never enough.
Of course, it's never enough. We appreciate the development partners. And not only, we have so many, the DB, World Bank, we have the European Union, the KFW, Austrian government, there are many. They are all supporting the sector, but still the resources, much as all those resources are coming in, they are not yet enough to meet the demand and the pressure. Make sure that we achieve our desired position. So as I said, it's within.
So what can we call enough?
That's a very hard one.
No,
I can give you a very simple requirement. For example, we have done a bit of analysis. We have identified 438 towns that need support in the Eastern region, including Karamati. And when we put a figure what it would take to build the infrastructure, we needed about 120 billion Ghana shillings. Okay? Now, our annual budget as Water and Sanitation Development Facility East has been up to an average of 15 billion Ghana shillings. But we have a requirement of over 100 billion. How, when will you reach there? It's quite a process, and no, population is growing. And now we are increasingly, government is also having a little bit of pressure. There are many competing demands from government. Not only water, there are roads to do, there is too much.
And you can squeeze them more.
So that's why I'm saying that within the limitations of government, a lot is being done. But we need more.
Okay.
Yes, so I can also add, you know, all the players have a role to play. Yeah? Community, ministry, district, they have a role to play. We do our best. You commit money. But you know, when it comes to behavior change, because sanitation, hygiene, it's all about changing behavior of people. We find communities are so slow. They are not really that quick to appreciate it, embrace it, and make sure that they improve their situation. So with the resources we have, I believe we would have done a lot. But because even the communities have this notion that a lot should come from government, because surprisingly some people can sit back and wait for government to put a pit latrine. That is unacceptable. It is quite surprising.
Perception that the government should actually do each and everything for their citizens.
Exactly.
It's not a right mindset.
It's
now,
not.
as we wind up, let us talk a little bit about the achievements that you've had on this project, of the water and sanitation project. Right now, you've decentralized in how many districts right now? How many right now so far?
We have, what I can say is that the ministry has set up various offices covering the whole country.
Okay.
We have an office in Lira, we have an office in Mbarara, we have an office in Wakiso, we have an office in Mbale. We have a smaller office in Karamoja, in Moroto. We have a smaller office in Soroti. We have an office in Jinja. We have an office in I think even Fort Poto, Kabale. We have a lot of staff all over the country to try and address these issues. And the idea is that people shouldn't move all the way from the remote areas of the country to come to the center. On a bigger picture, and look at water coverage in the country now, we are standing at 70 in the urban, in the rural areas, 70% in the urban areas. Yes, one is that people want a higher level of service. They want a higher level of service, which we have not yet achieved. Much as we talk of 70%, people will contest. But the reality is that the only reason why they are contesting is that they want to see the tap.
With much effort.
Everyone, all individuals only appreciate that coverage has been realized if they have a tap in their yard. But we are not yet there, but that's where we want to be.
Okay, and so far, again, as an achievement, the joint effort support, is that also moving on well? The water joint support systems, the program that is, as the year ends, is that also working up well?
Yeah, we are not working in isolation as government. We have players like development partners, a number of NGOs, very active in water supply and sanitation provision. But if I can give you statistics, you know, when NRM came in government, came in power, and I think also the other achievements we've done, especially for the Eastern region, we've developed large gravity flow schemes. You know, being a system that supplies, I can say like Lima, we supply Manafa. You heard about Manafa? Mbali, you have Tororo. I mean, it's amazing. So there is a lot we've done, and I think we are still committed as a ministry to make sure that by 2020 we achieve the 78% water coverage in rural areas.
Thank you so much for joining us. That's it from us here. Thank you, James. Thank you, Paul. You guys have been great. And of course, thanks as well to the principal PRO of the organization. And of course, we've been delving a little more into the water and sanitation development program that is ongoing across the country. And as we wind up from this wonderful gentleman, he handles the rural part of the development, and then he handles the urban. As they give the full explanation, I think it starts from us as individuals to embrace, sanitation, to embrace hygiene. It's not just about the government to come up and sensitize us and tell us what to do. You can smell a dirty cup when it is dirty. So it is your job, it's my job to keep ourselves healthy and safe. My name is Patricia Nkoma. Thank you so much for being a part of us. For now, bye-bye.